The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. In the studio with me is Dr. Brad White, compounding pharmacist, and our guest, Dr. Mark Tawil. Is that correct, Doctor?
That is correct.
Cardiovascular and thoracic surgeon from Mercy Cardiovascular Institute. Good morning and welcome to the show.
Good morning.
Heart disease can happen at any age, and according to the Centers for Disease Control, younger adults are now being affected by the disease more often than in past years. High blood pressure, high cholesterol, smoking, and obesity are just a few risk factors. Advances in cardiovascular medical treatment are making an impact on life expectancy, and since February is American Heart Health Awareness Month, today is the perfect opportunity to focus on health awareness and talk about the latest advances in minimally invasive heart surgery and robotic surgery. We'd like to remind our listeners today that the program is available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anywhere, anytime. If you have questions you'd like addressed to us today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Doctor, welcome back to the show. Could you tell our listeners a little about yourself and your background, and how long have you been cardiovascular and thoracic surgeon?
I've been a cardiovascular surgeon since 1992, and specifically since 1995 I've been associated with the Mercy Medical Center, and since 2016 a member of the Mercy Cardiovascular Institute. I've really done most of my work as a surgeon at Mercy most of this time, and I continue to do it at this time.
You have been a surgeon in that division for really not a long time, but I bet you've seen a million changes in how things are handled, things are done, and all that sort of thing. Would that not be a guess that prior to 92 we weren't doing any invasive, minimally invasive surgery, that sort of stuff? Would that be about right?
That is correct. This really all came about more recently, and there are a number of things which are quite recent. For example, taking care of cardiac patients in the emergency room and taking care of heart attacks right there and then. Having a cath lab in the emergency room is something that actually Mercy was one of the first hospitals to have, and that's something that's done now. The other thing that's being done also is minimally invasive aortic valve replacement or displacement in this case. In other words, what you do is you have a patient who cannot undergo surgery because of various problems and has an aortic valve that has to be replaced. It can be done just like doing a cardiac cath through the groin. You just implant a valve in the place where the old valve is, and you crush the other valve, and the new valve takes place. And this is something only the past few years that we've seen.
If you crush the valve, where does it go?
It goes against the wall.
Okay.
But what you do is you have measurements of the area where the new valve is going to be placed, and you can tell what the size of the new valve has to be based on those measurements, and you actually put something to crush the valve and put another valve in its place. The valve is fed over a wire and over a catheter. It is kind of twisted around it, and when it goes into the exact location, you open it and the valve opens up and begins to function like a real valve immediately without any obstacles at all.
No chance that the old valve could, say, break away in the valve?
There's always a chance that pieces of calcium or cholesterol can break away in that location, but in general it's the new valve displaces the old valve against the wall, and there's no gap between the two for these pieces to go away. Now, of course, these patients are older patients in general, and they have disease in the aorta throughout, from the heart all the way down to the groin where you are feeding the new valve. There's always a chance that a piece of something inside the lining of the aorta can go to the wrong place. That can happen, but that can happen with any other procedure where you're using the femoral artery in the groin to accomplish anything.
What would you say? Excuse me. Well, what would you say would be the reasons that we've been able to move technologically to this level, like miniaturization, not X-ray, but technologically, you can look at it better with the equipment that we have now internally.
The biggest thing is, of course, is industry. Industry has developed in such a way over the past 20 years that you can feed an actual valve, which is, let's say, 3 centimeters in diameter. You can basically curl it and put it in such a position that it becomes about a few millimeters in diameter, and you can feed it over a wire in a catheter and put it in and have the mechanism to open it in the right place, and it opens perfectly. It's really a major advance in industry. Also, imaging has improved quite a bit, and you can see these things. Echo is very important these days. When you do a procedure like this, you always do an echo to make sure that there's no leak in the new valve, there's no leak between the new valve and the aorta. Imaging is so good at this time that you can't do it. And in fact, the other thing is, in most of these patients, they're sedated minimally. It's called, conscious sedation. It's just a small amount of medication they give them so that they are not aware of what's going on. They don't feel pain because you anesthetize them anyway. You put the valve in and they don't even know what's going on. They just feel relieved at the end because they can breathe better.
What do you see in an echo? I mean, what is the echo?
The echo will show you the area where you are actually opening the new valve in the location of the old valve. It'll show you where the coronaries are, so of course the new valve does not impinge on any of the circulation of the heart. You have to be clear of that. And also it'll show you whether the valve is leaking or there's any injury anywhere or leak between the valve and the aorta itself.
Is that the common reason for replacing a valve that's leaking, or
the most common reason is what's called aortic stenosis, which is the leaflets calcify, they become stiff, and they don't open the way they should. There are 3 leaflets in the aortic valve, and you should be able to open and coapt the leaflets so that there's no leak. With age and for various reasons, the leaflets can calcify and become stiff. They will not move anymore, and the area of opening of the valve goes from, let's say, 1.5 to 2 centimeters squared to less than 1 centimeter squared. And with that, the patient will become symptomatic. They'll be short of breath, they may have chest pain. And when they become stiff like that, the only way you can do something about the valve is either to do a surgical procedure where you open, take out the leaflets, and put a new valve with sutures inside, the way it's traditionally done, and it's still done now. And at the same time, the other possibility is to put a new valve in the old one through the groin, if that is a feasible
inside
solution.
inside the old valve.
Inside the old valve, which is crushed on the side.
No kidding. That's amazing. So, okay, 20 or so years ago, or even long ago, we were talking heart transplants and artificial hearts. And I mean, the first thing happened in South Africa many years ago. Has all this new technology sort of replaced the research in that area, replacement of your heart with somebody else's and artificial, that sort of thing?
No, it's something that's still being used. I mean, transplant is still going on, right now. The new valve or these new techniques, whatever we do not replace heart transplant. If you have a heart that is otherwise structurally normal but is completely failing, and the ventricular function is very, very poor, you may still be a candidate for heart transplant. You can replace the heart, put a new one, with new muscle basically and better function. Some people have had many operations like coronary bypass or valve replacements and so on, and the valves are still functional, but the function of the heart is very poor, and the patients are failing. They have
the heart muscle.
The heart muscle is very poor, so there's nothing you can do about that except replace the heart.
Sure. And so, off the top of your head, how many heart transplants do we do annually in America? Any?
About 3,000.
Oh, kidding. You never hear about it, which is
not that common, but I don't think there are enough hearts to go around. Also, if there are more hearts available, then you'd be able to do it.
Sure. What's the difference between cardiovascular and thoracic surgery?
Thoracic surgery involves anything inside the chest. That includes the heart, the lungs, the esophagus, the blood vessels, anything inside the chest. But cardiothoracic specifically involves the heart, in general, but it can involve the blood vessels also.
Amazing.
Okay, doctor, you're part of the Mercy Cardiovascular Institute at Mercy Medical Center, or MCI for short. Can you talk about MCI and how it functions?
MCI is an institute which includes a number of people. It includes the surgeon, of course. It includes also the cuts and other procedures also on the heart. And others are diagnostic. They evaluate patients. They do echoes. They do stress tests. And also you have, of course, a whole background of nurses and medical assistants and secretaries. All of these people work together to process a patient if they come to Mercy Cardiovascular Institute.
We've talked a little bit about technology and advances this morning, and it's my understanding that at MCI you do minimally invasive heart surgery versus open heart surgery. Can you talk about the differences and how the patients can benefit with recovery times and probably overall risks too?
In minimally invasive surgery, what you try to do is to not do the long incisions or the usual standard, which are, time-honored incisions, where you actually, let's say, open the sternum from beginning to end, expose the heart completely, and do the procedure that you want. What you try to do is to minimize the incisions with the intention of minimizing the patient's length of stay, discomfort and pain, and try to achieve the same result that way. One of these examples is minimally invasive coronary artery bypass surgery. The most common thing to do in this case is called mid-cab, which is a situation where you go between the ribs on the left side most of the time and find the spot on the heart where you're going to do the bypass and use one of the vessels inside the chest as a bypass vessel, and this is called the left internal mammary artery. Excuse me. That vessel is used to bypass any blockage in the heart. Usually the heart is exposed on the front, and you can see the left anterior descending coronary artery, which is the usual culprit vessel. You do the bypass that way. You leave a chest tube on that side. You don't have to hook the patient to the bypass machine, arrest the heart, or do anything with the bypass machine. You just do it with the heart beating and achieve the same thing. This is typical for situations where you have one graft, one or two sometimes. In the future, it is hoped that it will be achieved also with a robot by doing more than 1, 2, or 3 grafts. And some people do that, but very few centers do more than 1 or 2 grafts that way. So now that you mentioned robotic surgery has also entered cardiac surgery. You can do the same procedure the same way. Instead of making a small incision between the ribs on the left side, you go with the robot arms inside and harvest the mammary artery, which is the main conduit you're going to use, the main source of blood here. When you harvest it that way, then you make a small incision and hook that artery to the area of the heart that needs the blood and that's missing the blood at this time. So in that sense, you're minimizing the amount of pain, minimizing the amount of incision, and hopefully getting the patient out quicker from the hospital and back to work.
Amazing. I guess the benefits of minimally invasive then, your faster recovery times, shorter stays in hospitals, hopefully lower medical bills and complications and things of that nature. What about any difference in length of how long a repair like a bypass like that or a graft would last? Same situation as if you did open heart, or
it's very similar, really. You achieve the same thing a slightly different way, and the results are comparable.
Amazing. Okay, well, we wanted to mention today that this is Women's Heart Health Month in February, and anyone who wears red in our stores today can get an extra 5% off their over-the-counter purchase. So stop in the Medicine Center today and be educated and become more aware of Women's Heart Health Month.
Okay, we know that arteries... I'll catch this when we come back. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Make a handmade heart for someone special. February 2nd and 9th at Studio Arts and Glass. Learn glass slumping in this 2-hour class, good for all ages. Call 494-9779 for more information or see samples at studioartsandglass.com. If you don't want to make one, come buy one at Studio Arts and Glass, where the gift shop's open Monday through Saturday from 10 to 6. StudioArtsandGlass.com.
It's winter weather season, which means dry, irritated skin can be a problem. Medicine Center Pharmacy can help you stay moisturized for less. Save on our Quality Choice line of products during our buy one, get one free sale. The Quality Choice brand is the same as national brand items, but without the price tag. Stop into any Medicine Center Pharmacy and stock up on all Quality Choice products, including skincare, cold and flu remedies, feminine products, and more. Mix and match all Quality Choice and save big. Free item must be equal or lesser value. Visit medshoprx.com for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about cardiovascular and thoracic surgery with surgeon Dr. Mark Tawil from Mercy Cardiovascular Institute. Have a question? Post it on our live Facebook feed.
At the break, we were going to get into something else. You mentioned you wanted to touch on mitral clips. How about we tell our listeners what that is and who could benefit?
Mitral clips are actual clips that you can feed into the left atrium and then at the area of the mitral valve. It's a kind of clip that will catch part of one leaflet of the mitral valve and the other. The situation where you apply those is when the mitral valve is leaky, something called mitral regurgitation. Mitral regurgitation means that the heart is supposed to empty into the aorta only, but the mitral valve leaks and part of the blood coming from the left atrium left ventricle goes into the left atrium and is lost. It has to come back to the left ventricle and be pumped again, and still part of it is lost every time. So it's a never-ending circle. So these patients ultimately end up with heart failure. But if you have a mitral clip that you can apply percutaneously also through the groin into the left atrium and into the area of the mitral valve, you can catch both sides of the mitral valve leaflets so that they coapt, they can touch each other, and the leak decreases that way. And the function of the ventricle will improve because the blood will go into the aorta specifically, and very little will go back into the left atrium. So this is one way of taking care of a problem, rather than, of course, opening the chest and replacing the valve or repairing the valve. we still do, valve replacement and valve repair, but in situations where the proper patient is chosen, you can apply a mitral clip and improve the function of the left ventricle over time.
No. How many flaps do we have on that valve?
The mitral valve has 2 leaflets.
Okay.
In other words, it's 2 leaflets which are curved, and when the valve is closed, they coapt. They close against each other, and no blood leaks through that. But if you have mitral regurgitation, the 2 leaflets do not touch each other. They are separated, and blood is always leaking from the left ventricle into the left atrium.
Well, was that known as prolapse at one time?
Prolapse means the actual leaflet of the valve tents. Prolapse can have regurg, can have a leak, and it may not have a leak. Prolapse is a description of the valve leaflet itself also, but not its function.
Okay. So in heart surgery now, chest surgery, we're doing a lot less breaking the breastbone and opening up the chest. What about infection? Less with the minimally invasive?
Probably so, because you're not dealing with a very large incision, of course. You're not dealing with any bone being opened. It's a shorter time, usually. Anything that decreases the time, you're less likely to have infection. Now, we have to remember that you still have to open the chest for certain patients. You still have to replace the valve. You still have to repair it a different way. This is not for every patient, just like the aortic valve replacement is not, the TAVR we mentioned, is not for every patient. But there will be indications for both. There'll be people who will be in this category and other people will be in the other category.
Well, I'm hearing that the minimally invasive and the opening the chest is age related, that certain ages get one kind and the other normally. Is that true?
Age is very important, definitely. Older patients will tolerate a major operation much less than younger patients. And so if you have an older patient who's still functional, who still has good mental function and really wants to improve his life and has a problem with either the mitral or the aortic, and it's something that can be done through the groin by feeding whatever you want, a mitral clip in this case or aortic valve, it is something that you can apply, and these patients bounce back, of course, quickly, because you don't have to keep them to for several days in the hospital. With the valve replacement that you do in the cath lab through the groin, usually it's an overnight stay. So the following day people are up and around and then go home, and they can tell you, I can breathe much better right away.
Wow.
So these are patients that you really want to
wow, amazing. That's just amazing. Okay, it is the bottom of the hour. It's time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Are you tired of paying hundreds of dollars to find out your A1C and cholesterol levels? You don't have to do that anymore. Every month in each of our pharmacies, you can get your A1C lipid profile, which includes your cholesterol levels as well as glucose results, while you wait. A Medicine Center pharmacist will draw your blood and give you the results in just minutes. You can also get your blood pressure checked for free. Call us to find out when we'll be in the Neighborhood Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. 330-454-8772.
Make a handmade heart for someone special. February 2nd and 9th at Studio Arts and Glass. Learn glass slumping in this 2-hour class, good for all ages. Call 494-9779 for more information or see samples at studioartsandglass.com. If you don't want to make one, come buy one at Studio Arts and Glass, where the gift shop's open Monday through Saturday from 10 to 6. StudioArtsandGlass.com.
The Medicine Center Pharmacy makes remembering to take your medication easy. Our personalized dose packaging helps keep your medication organized. It's simple, and we package your medication based on when you should take it. So you can take your medication at various times throughout the day, you say? No problem. We can package your medication with the date and time, so all you have to do is tear off your packet and take it with you. Now you never have to wonder if you missed a dose or not. Let us help you keep yourself healthy at the Medicine Center Pharmacy and save money at the same time. We're located in Stark and Tuscarawas counties.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about the latest advances in minimally invasive heart surgery with Dr. Mark Tawil, cardiovascular and thoracic surgeon from Mercy Cardiovascular Institute. We've got a lot more to cover this morning, so let's get back to the show. Go ahead.
Okay, we had some questions over the break, and I know, Doctor, you wanted to touch on the warning signs and what to do when you have a cardiac-related event. So if I wake up today and I have really heavy chest pain and some numbness in my arm, what are your recommendations for a patient that are having some symptoms that could be a heart attack-related type symptom? And maybe you could cover those and the differences between men and women, because they are different, right?
They can be, definitely. The symptoms for a heart attack can be variable. It can be chest pain, it can be arm, neck, jaw, back. It can be without pain also, and you can have what's called silent heart attacks, and that's not unusual in diabetics. In fact, you can see patients who've had multiple heart attacks and have decreased function of the heart because they've had multiple heart attacks. They have blockages in various arteries, and as you close one after the other or narrow down one after the other, you can lose function more and more. So it's very important for somebody who has symptoms like this to check with the family doctor first, especially if they have risk factors. The biggest thing is risk factors. Number one, of course, is smoking, high blood pressure, high cholesterol, diabetes, family history, and many others also, but lesser factors. If anybody has any of these risk factors or a combination of those, it's important to keep an eye for a possible heart attack in the future. You check with your family doctor and see if they have any opinion about that. If the symptoms are really severe, of course, the first thing you do is you go to the emergency room. At the emergency room, you can be evaluated. They can get an EKG, they can get a chest x-ray, they can get blood work also to see if there's any enzymes that indicate that you are having a heart attack, and based on these results they can channel you to whatever needs to be done. For example, if the symptoms are typical and all the tests are negative, you can always have a stress test. The stress test can be done during that admission to the emergency room. You get admitted to the hospital and be taken care of then. Or if it's something that's not typical of a heart attack and you're still concerned about it, you can have an outpatient stress test, come back for that and be evaluated then. Or if it is a real heart attack, of course, you get admitted and processed in the system. Now, if it looks like an acute heart attack, then the first thing is to do a cardiac catheterization. And you look in these cases for the vessel that is causing the problem, and the intervention cardiologist will do this, of course, in the emergency room cath lab and interfere, in other words, put a stent or angioplasty, open the vessel, and stabilize the patient. It could be the only thing you need to do, or it could be something temporizing and you have to move on to something else later, whether it be further stents in the future or even an operation.
How do they know where to go with that cath?
The cath involves looking at all the vessels of the heart.
With some sort of a screen.
Yeah, what you do is you look at, excuse me, all the vessels of the heart, and you can tell which one is having problems, and based on that, decide what needs to be done.
So if you go through the groin, or they're telling me now you're going through the arm or something like that with a cath, one or the other more effective?
Not really. You can achieve the same thing in both. If you think you're going to interfere and put a stent, it's probably better to go through the groin because it's a bigger artery. If it's just a diagnostic and you think nothing is going to be done, then you can go through the arm. The advantage of the arm, of course, is that you can get up a little faster. You don't have to lie flat that long, and you can go home earlier.
So a cath, there's two reasons for a cath. One, to check for the condition of the artery, but also to
interfere, yes.
To place a stent if needed. Okay.
That's correct.
Okay.
Can you have a heart attack and not know it?
Yes, you can, especially if you're diabetic. Diabetics are known to have silent heart attacks. Again, the symptoms, even in non-diabetics, can be minimal, and people, I'm having a little indigestion, and indigestion may not be a real indigestion. It may be, an acute attack.
Well, the burning of the esophagus and all that sort of thing from whatever high spicy food or anything like that, certainly that can mimic.
It can mimic a heart attack.
Mimic a heart attack. Which
yes.
Maybe we should stop eating all the Mexican food, honestly. Or heavy seasonings.
that may be the case in some people, yeah.
Okay. All right. Okay. What about the financial aspects here of minimally invasive as opposed to literally tearing open the chest?
In the case of minimally invasive, you're doing, let's say, a mid-cab. You're not connecting the patient to a bypass machine, of course, so that there is some saving there. And also the length of stay is shorter in the hospital compared to opening the chest and doing it the conventional way. So there is that financial aspect. And of course, going back to work typically is quicker with the mid-cab than a regular sternotomy where you actually open the breastbone. So there is that aspect to consider too.
What about the time issue here? Okay, so as opposed to invasive to minimally invasive surgery, same amount of time, less time?
Very similar, really, as far as the operating room is concerned. I mean, it probably takes about the same time with less involvement of machines in the minimally invasive part.
Okay, so all right, that covers it, I guess, doesn't it?
What about, we had a question from Maslin from Tom about the Watchman device. Can you give an explanation of what that is and who it benefits?
This is a device which you can put in the opening of the left atrial appendage. The left atrium is the area where typically you may have clots if you have an irregular heartbeat, especially atrial fibrillation, which is a very common irregularity of the rhythm of the heart. If you have that, then there is the likelihood of developing clots in the left atrium, and they are typically in the appendage. If you look at the structure of the heart, and there's the atrium and there's the ventricle, there's the left and right atrium, and the left atrial appendage, which is an extension of the main cavity of the left atrium, which looks like an ear actually, is the area where the clots are going to be forming with the irregular heartbeats. If you put a device at the mouth of that appendage, you can prevent these clots from happening, or any clots which are in there cannot come out and be circulated through the heart to the brain and give you a stroke. So this is a device that prevents strokes in general and is aimed at people who have irregular heartbeats, specifically atrial fibrillation, which can cause clotting in the heart.
So it's almost like a advanced filter. Is that a fair analogy?
Yeah, it's like a filter. It doesn't allow the clots to come out, definitely. Okay. And it's a watchman. It's just it's a guard.
Interesting. Okay. What's next on the horizon? It seems like there's so much technology that you can benefit from to do your job better. Is there something you've been reading about that you're excited about, or maybe Mercy's participating in?
Well, the big thing that we'll probably be having the mitral clip, which is a very important advancement also. I think it's going to be refinements of so many procedures that are done, which will be in the future, and it all depends on what industry comes up with, because really between science and industry you can come up with better ways to do things in the future.
Who's the most innovative in the world, America or other countries on this?
I think it's probably the United States, and Canada, of course Europe, okay, especially Western Europe, Japan, and of course China now.
No kidding. China, wow. They got a lot of people over there.
They can be creative too.
Out loud. Okay.
We talked a little bit about signs and symptoms of heart disease. Maybe we would be remiss, given it's Heart Month, can you touch on activities that you can do to keep yourself healthy and put yourself on the side of the odds of being maybe not having yourself at higher risk? We talked about, don't smoke and some other things in the opening comments, but can you talk to taking care of your own body to keep your ticker ticking?
Obviously, exercise is very important. Everybody mentions that. What you have to do is reduce all the risk factors. And the way you do it is, of course, take care of your blood pressure, take care of your cholesterol if it's elevated. If you're diabetic, control your sugar. Be active all the time, definitely. Those are the big things that you have to do.
Can we dissolve? Is that on the horizon that we can dissolve cholesterol?
Someday. I mean, this is going to be, of course, something that industry may contribute. It is very possible that may happen.
Wouldn't that be one of the major solutions to all this?
It would be. Well, you lower it first. It's important to lower it.
Yeah, sure.
But if you have an actual deposit in the body, maybe one day they'll be able to dissolve it. But no, we're not there yet.
Yeah. Okay. Interesting.
Well, you still need cholesterol. I mean,
for other things,
it's important
definitely. Sure.
Yeah. So it's a double-edged sword, but like anything else, too much is no good, right?
That's correct.
So. All right. What about minimally invasive aortic surgery? Do you have any other comments you'd like to speak to on that?
Yes, there is, of course, the possibility of taking care of aneurysms and dissections in a minimally invasive way. For example, if you have an aneurysm of the aorta, whether it be in the abdomen or in the chest, you can also put stents, just like you put stents in blockages of arteries in the heart. You can put stents to block these aneurysms. So an aneurysm is basically a ballooning out of the main body of the aorta, and the problem with the aneurysm is that it can grow, and beyond a certain size there is the risk of rupture and death. So if you can put a stent is a tube that goes above the aneurysm and below the aneurysm and becomes the new aorta, so to speak, and prevent any blood from going into the aneurysm itself. This is one way of preventing it from growing and rupturing, and we do this all the time. I do this myself also.
How large is the aorta?
The aorta is about, in the chest itself, it's about 3.5 centimeters in diameter. In the abdomen, it's down to 2.5. In the thoracic aorta is in between those two. So anything that grows above 3 begins, to be an aneurysm in the abdomen.
Well, that takes a big stent, doesn't it?
The stents are large, compared to the stents you put in the coronaries of the heart. These are much larger, definitely. The diameter, is going to be 25 millimeters.
Wow.
On the average. In the chest, it's more than that.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy. Our final break is here.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, and you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit MedShopRx.com for more information.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
It's winter weather season, which means dry, irritated skin can be a problem. Medicine Center Pharmacy can help you stay moisturized for less. Save on our Quality Choice line of products during our buy one, get one free sale. The Quality Choice brand is the same as national brand items, but without the price tag. Stop into any Medicine Center Pharmacy and stock up on all Quality Choice products, including skincare, cold and flu remedies, feminine products, and more. Mix and match all Quality Choice and save big. Free item must be equal or lesser value. Visit MedShopRx.com for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing robotic surgery and more with cardiovascular and thoracic surgeon Dr. Mark Tawil. Am I saying it right, Doctor?
Tawil is fine.
Every time around,
yeah.
From Mercy Cardiovascular Institute. Let's get back to the last segment of the show. So, we understand, Doctor, that you perform TAVR, T-A-V-R procedure, which is a minimally invasive alternative to aortic valve replacement surgery. What does TAVR stand for? What exactly is it, and how does it differ from traditional aortic valve replacement surgery?
It is trans-aortic valve replacement, and it's done at Mercy in conjunction with the cath lab. Dr. Sabe is the primary person who does that, and we are on standby in case something has to be done in addition to what he does. Basically, you have a patient who is on the cardiac catheterization table, who is sedated. He doesn't have to have a breathing tube or intubation, with a tube in his throat. Typically, they're older patients who are not able to breathe well or have chest pain because of a very narrow aortic valve. And the valve can be replaced. It can be replaced surgically by opening the breastbone, but because of various reasons, specifically these patients are high risk for any kind of surgery, they are deemed candidates for TAVR. So what's done in that situation is you basically go through the groin in the femoral artery and feed a wire and a catheter, and over the catheter, in the catheter itself, you have another device that goes in, which is a valve that has been crimped, that has been wrapped around that wire and catheter, and you feed it into the area of the valve that has to be replaced, or in this case, crushed and put aside. So once you go to the area where you want to put the valve itself is, the old valve is crushed and against the wall. The new valve takes its place in the proper location and is opened and begins to function immediately as a new valve with no hindrance to any kind of drainage from the left side of the heart to the aorta, and therefore circulation to the rest of the body.
That's amazing. So this is a person who, this is like a life or death situation, would you say that?
In general, these people have very, very narrow valves, and any further narrowing will mean death to them.
So that means immediate, we have to do this like right now.
as soon as possible, usually whenever you discover it to be so serious.
So, what conditions or diseases cause a patient to need aortic valve work? I mean, many different things.
Usually it's aortic stenosis. Aortic stenosis means the actual leaflets of the valve, which are 3 in the case of the aortic valve, become stiff, they become calcified, they are not movable, they move only very little and allow very little blood to come out of the heart to the rest of the body. And in that situation, it's a progressive disease. It gets worse over time, and if it does narrow further, it can cause sudden death or episodes of chest pain or, shortness of breath that's continuous. They cannot go up the steps, they cannot do minimal housework.
So it's a big...
We have other valves in our heart, though.
Yes, there are 4 valves in the heart.
And various functions, like they're on the aorta side as well as the venous side?
Well, yes, the aortic valve basically empties the left ventricle on the left side of the heart into the aorta and the rest of the body. The mitral valve, which we mentioned a little earlier, is a valve between the left atrium and the left ventricle, and allows blood that has been oxygenated in the lungs to be drained from the left atrium where it gathers, goes to the left ventricle, and from that ventricle through the aortic valve to the rest of the body. That's on the left side of the heart. On the right side of the heart, you have blood coming from the vena cava, which is the big vein that drains the lower extremity, and the one from the head also, the 2 vena cava. They go into the right atrium, and there's a valve that empties between the right atrium into the right ventricle. That's called the tricuspid valve. That tricuspid valve is similar to the mitral valve. It's the equivalent of the mitral valve on the other side of the heart. The right ventricle empties the blood into the pulmonary artery, the artery that goes to the lungs. And there's a valve between the right ventricle and the pulmonary artery called the pulmonic valve. That valve allows the blood to go into the lungs, where oxygen is added to the dark blood that has already circulated in the rest of the body and gets oxygenated, and from the lung it goes back to the left atrium, which is going to empty it into the left ventricle, and the cycle goes on. So it's dark blood without oxygen on the right side that ends up being in the lungs. The lungs give it oxygen and sends it back to the left side of the heart to go to the rest of the body.
So still, the aortic valve is the one that is the most problematic here, or not?
Yes. When you're doing TAVR, it's the most problematic because it does not allow the blood to come out of the left heart to go to the rest of the body. The pulmonic valve is typically not a problem in adults, and the tricuspid valve typically is not that big a deal either.
Can you replace this valve in like a baby, a newborn?
In the aortic valve?
Yes.
Yes, you can do that. There are babies who are born with very, very small narrow valves, and they have to be opened. Yes.
But whatever valve you put in, wouldn't it have to be replaced later in their life?
It does, because the baby has to grow.
Sure. And your valve doesn't grow.
This one does not grow. It's fixed. It's fixed, yeah.
All right. I know there's a lot of causes for this aortic valve issues, and we probably can't go much further with that because of time constrictions. But anything else that we missed here?
Basically, this is it. The aortic valve is obviously a big deal, and it's something that's being done more and more. And I think in the future, the indications for replacing the valve may spread to even younger patients, because people are interested in less invasive procedures all the time, and the way this world is going to go to less invasive procedures. You're going to have people who are not 90 getting a valve replaced, but even 50 if they need it, because they'll request it at this time.
What did we miss, Doctor? We got a minute and a half or so.
Any questions from?
What about how about you let our listeners know about Mercy's unique because it has the cath lab in the ER, right?
That's correct, and the time between the discovering a heart attack and entering the vessel and opening it or stenting it is definitely a record here. So they were the first to do it in this area, certainly, and continue to do it very efficiently.
Well, that's impressive. So every second counts, right?
Every second counts. Every second lost is loss of muscle in the heart.
Okay. Well, Doctor, we thank you for your visiting today. Do you want to leave your contact information or how listeners can reach out to MCI if they can go to Mercy's website?
Mercy's website, MCI, the number is there. They can call and ask, whatever doctor they want to contact and have an appointment anytime.
Very good.
Okay. Thank you, Doctor.
Thank you.
Very good day. Program. We enjoyed it.
Thank you very much.
A lot of information. Cardiovascular and thoracic surgeon from Mercy Cardiovascular Institute. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis, as always. We thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We're a local Health Mart pharmacy caring for you and about you. Have a healthy week. We'll see you again next Friday right here on News Talk 1480 WHBC, and tomorrow is Groundhog Day.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.